Radiation Therapy by Paola, Stephanie, and Nayeli.
Pierre Curie isolated two known radioactive elements from uranium ore and used radiometric methods to identify which stream the radioactivity was in. After each chemical separation, they separated the uranium ore into each of the different chemical elements that were known at the time and measured the radioactivity of each fraction. They then attempted to separate these radioactive fractions further to isolate a smaller fraction with a higher specific activity.
Radiation is used in nuclear medicine that provides diagnostic information about the function of a specific organ. Radiation is a treatment which would use radioisotope. There is a great way to identify some diseases or cancers by radiotherapy. Radiotherapy will treat medical conditions, for example, leukemia. This is a cancer of blood-forming tissues, hindering the body's ability to fight infection. It also occurs when same blood cells acquire mutations in their DNA. The instructions inside each cell that guide its action. To add on, 40 million medical procedures performed each year, increasing up to 5% annually. Radiotherapy is an important sterilization of a medical equipment. The use of radiotherapy requires high-energy radiation to shrink tumors and kill cancer cells. Some uses will be X-rays, gamma rays, and charged particles. All of these are types of radiation used for cancer treatment. When radiation therapy is systemic because it uses radioactive substances such as radioactive iodines that will travel in blood to kill the cancer cells.
By all the information that has been gathered, nuclear chemistry is a helpful resource in our daily lives since our modern technology is becoming more efficient as we are discovering many ways to treat our patients that are diagnosed with leukemia. Like we stated before, radiotherapy treats medical conditions, especially cancer, to weaken or destroy particular cells. Some may argue that radiotherapy damages organs that are near the pancreas, for example, kidneys, stomach, and liver. Although there might be drawbacks to radiotherapy, it helps to determine the process of chemical reactions to trace the movements of atoms in biological systems. To conclude, radiochemistry is a radioactive material in which radioactive isotopes of elements are used to study the properties and chemical reactions of non-radioactive isotopes.